Bonjour, my name is Ashley, and I'm here to speak about the most important skills of Communications 201. I've learned a lot of important skills throughout this course to use in my current employment position and when I become a nurse. The first aspect that I learned in this class are the fundamentals of successful public and professional speaking that we learned about in week 2, where we organize our thoughts. In this way, I can create an outline mentally or on paper for the topic I am due to discuss with coworkers. I can also tailor my message to whom I'm speaking to. For instance, using medical jargon for medical professionals or layman's terms for patients. And we learned about that where I got that's according to Lucas, the art of public speaking. I also learned a persuasive speech, which was in week 6, and I learned how to set a clear purpose. So this will help me in my workplace by explaining the points I want to touch on with coworkers, to set a foundation for what I'm trying to explain, so they won't guess while I'm conversing with them and taking up their time. I also learned to structure the message. I first would describe the problem within the workplace, describe the solution I feel is best, then explain what I think the outcome should be. And with those outcomes comes along benefits. I also learned credibility. So how competent I am, basically how much knowledge I will have on the subject, the character, my character, and do I sound honest? And charisma. Am I enthusiastic about what I'm speaking about? The other important thing we learned in week 3 was informative speech. And here we learned to speak about or give information about objects, which could be diseases, processes, for example, medical examinations, and how-tos. How to insert a Foley or a wound care would be beneficial in my nursing career. Also, events. Events like things that will happen in sequential order, like evaluation, surgery, and recovery. I also learned to inform on concepts. According to Colorado State University, concepts can be beliefs, ideas, and theories in the healthcare practice or healthcare setting. So in conclusion, all aspects of this course will help me become a better nurse when it comes to explaining procedures and the steps in the healing process. I may have to even persuade a patient that the way they're living is unsafe. Combining all aspects of this course helps me be a more empathetic person and allows me to communicate more effectively.